For joining us. Apologies for the technical difficulties that we were having. My name is Sydney Cruikshank, and I'm from the PHN Education team. I'm joined today by Kylie Ash, who is the Education Coordinator at Advanced Care Planning Australia. Before we begin, I'd like to acknowledge the traditional custodians of the land that we live and work on. For myself on the Central Coast, that is Darkinjin country, and I'd also like to pay respects to all elders past, present, and emerging. Now, a few things to let you know about this session. We have switched it to Teams, so welcome. Thank you for joining us. We will be recording the session and have a copy of the presentation slides in PDF form available on our website in a few days' time. As attendees, please keep your camera and microphone just muted for the duration. And at the end, please feel free to come on and ask any questions or just put them in the chat box. I will work on an evaluation while we are here so we can get that to you at the end of the session as well. And besides that, sit back and enjoy, and I will introduce Kylie Ash.
Thanks very much, Sydney. So as Sydney has mentioned, my name is Kylie Ash and I'm from Advanced Care Planning Australia. If you don't know Advanced Care Planning Australia, we're funded by the Australian Government Department of Health and Aged Care and act as the national voice of Advanced Care Planning Australia. So thank you for having me here today, and apologies for some of the technical difficulties. Some things it's difficult to plan for. And I'll be providing an overview of advanced care planning, and in particular in the primary care context, looking at how to raise the topic, how any documented wishes and preferences can be made when needed. So I'm just struggling to change my slides. Just bring that across. And preferences when they need to be made available. So before we go any further, let's take a moment to acknowledge country. In the spirit of reconciliation, Advanced Care Planning Australia acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples here today. I'm coming to you from the traditional lands of the Yugamaba and Yagara peoples. So a real challenge, when we look at what is advanced care planning, a challenge has been to support people to make very specific and binding decisions on uncertain future health situations. And really, advanced care planning is evolving at the moment beyond a sole focus of written documents to really that critical task of preparing people with serious or chronic illnesses and their loved ones for future decision making. And often differing from deciding, does not always require completion of an advance directive or a set of medical treatment orders. Whilst documented plans are ideal, it really is that ongoing conversation which is important. It's the cornerstone of person-centred or indeed person-led care. And it's really enabling people to share their values, their goals and preferences about future healthcare if they are unable to communicate or make decisions in the future. And it can also help families and carers to be informed and supported in the event that they need to make a decision on the behalf of the individual. And it also helps the person's healthcare team to define and frame and operationalise what that person-centred care looks like. Often loved ones, substitute decision makers, they're placed in very difficult and stressful situations trying to make a decision for a person at a time when their own decision-making ability may not be great. Often they're not aware of the true wishes and preferences. I'll just pause that briefly, sorry. They're not aware of the true wishes and preferences of others. So I want to share with you this video to reflect on the importance of advanced care planning. And please just let me know if the sound doesn't come through, as we didn't test this in this platform.
Anita and John is my dad. My name's John. I'm Quibi's husband.
So Roy gets to go on a trip of a lifetime. Where does he want to go? I'd say Bora Bora.
I definitely want to go Bora Bora.
What food could Anita not live without?
Probably curry.
Anything Asian?
He couldn't live without a lot of food. And what about you? What food could you not live without?
Probably fruit in general.
Probably chocolate. I need to ask me. Now, what's this about? So I don't know.
You can think about a moment where you pushed through a hard time together. You describe that.
At school, when she was being bullied, we had to see some counselling.
Just talking me through it and helping me get through it. Kind words and lots of hugs.
For me, it was probably the time when we were first trying to have our first child, I guess. We went through IVF and things like that. Becoming parents is something that we all hoped would come naturally, but it didn't to us initially, and we worked through that together.
Roy's hurt in a car accident. He needs a breathing tube for the rest of his life, and he'll never speak again. Would you consent to this?
Well, yeah. I would, yeah.
No, I wouldn't. Definitely not. I don't think I would want to burden anyone with that. So I'd rather not.
Anita had 3 months to live. Treatment would give her an extra 2 months, but she would never see outside of a hospital. Would you consent to treatment?
Yes, this was a good one. This one, 2 months. You know, it's just 1 week, 2 months, any time.
Not at all. No.
That's unexpected.
I don't want to be kept in a hospital for forever.
Don has had a massive stroke. Does he want a feeding tube to keep him alive, even though he'll never talk again? No.
No, I don't. It's very important to me to be happy and functional in my life. No, I wouldn't want that to happen.
Roy's in the last stages of terminal cancer, and his heart stopped. Does he want CPR?
If you would, no, I don't know.
So how do you both feel after answering those questions, and why?
It felt quite confronting in a way. But
You think about it and you talk about it just very lightheartedly, but I think anyone really puts a lot of thought and serious thought into it.
Why do you think that some couples don't talk about this?
It's not a pleasant subject. I mean, nobody wants to dwell on the fact that they're going to die one day, and possibly in adverse or difficult circumstances.
So if I was to tell you that advanced care planning is essentially a conversation that helps your loved one to know what medical treatment to choose for you if you had a sudden event, what would you think about it?
I think it's a great idea.
Yeah, absolutely.
It's important, not just for yourself, but also for your family, I think.
Definitely have to have a bit more talk, and it's not just about the two of us. We
Got
also have
kids.
kids and all that kind of stuff. Yeah. So there is a bit we need to consider. Yeah, 100%.
So that's quite an emotive video there, but really at the heart of advanced care planning, people are reflecting on who would they want to make decisions, what would they want them to know, and do others know those wishes and preferences? Advanced care planning can sometimes focus on decisions around medical treatments and interventions. But when these conversations are started, and often in primary health care, the person may be actually quite well, and it's difficult to consider and make decisions for every eventuality and context. Many times it may be other things that are important to the person to consider. For example, what does good quality of life look like? Where would they want to be cared for? Who would they like to have around them, including pets? What music would they like played? What are the spiritual, religious, or cultural practices and rituals that are important to them? And perhaps some of the beliefs or values that inform the context of their actual decision making. And I guess it's important to remember that with advanced care planning, this is an ongoing process. And if health issues do arise, then an individual can review and update their plan and make decisions based on the new information or the person's changed circumstances. So let's just have a look at the New South Wales context of advanced care planning. In New South Wales, common law advanced care directives are the only advanced care directives that exist and are legally binding. In addition to identifying personal values about dying, an advanced care directive can be used to refuse or request treatment, particularly a treatment at the end of life. And if a person with capacity has made a common law advanced care directive giving a direction about their health or medical treatment, that direction must be followed if a person no longer has decision-making capacity, and the direction relates specifically to the medical treatment or healthcare situation that has arisen. A substitute decision maker is not needed as the decision has been made, but they may be consulted to help understand the advanced care directive and as good practice. Now, there are some special provisions when a common law advanced care directive will not apply. In particular, a health professional can refuse to follow a common law advanced care directive if they believe that the treatment is futile or non-beneficial. And in those circumstances, the health professional cannot be required to provide treatment. Also in New South Wales, if the person does not have a valid advanced care directive, a default decision maker known as a person responsible can make the decision. And this will be a person from a hierarchical list, aged 18 years or over, who is able and available and willing to make the decision. This person may be appointed by the individual as an enduring guardian to undertake this role. And I encourage you to have a look, if you have further questions about the legal elements of advanced care planning, to have a look at the End of Life Law in Australia website. So in New South Wales, there is no statutory form that must be used. This is, I've shown you an image there of the New South Wales Advanced Care Directive booklet that is available at no cost to download from the website. And this includes a guide to advanced care planning and how best to fill out the form, some information, and the form that is recommended. If a document is created as part of the advanced care planning process, we do encourage that people share a copy of this document, first and foremost with their GP for storage, also their family, their substitute decision makers, loved ones, and the wider healthcare team as well. We recommend uploading the document to My Health Record to further support access. And a big part of the policy and advocacy work that Advanced Care Planning Australia is undertaking at the moment is to drive strategies to support interoperability between systems, to support improved access to these digital documents, because we know that there are some challenges there. And these stories really further highlight that the process of a conversation at all ages is really important. And when the time comes, having this information to hand is critical to support care which respects the person's wishes and preferences. For example, the medicine cupboard. Paramedics will often ask for people's medications when attending the person in their home and can source a plan there. Advanced Care Planning Australia also has these great wallet cards that are a great idea to ensure that others can know where a person's documents are being held and who their substitute decision makers are. These are actually our largest downloads off our website at the moment. And we also now offer an A4 plastic magnetic sleeve so people can store their important information, say on their fridge as well. So why general practice though? It is no surprise we have an ageing population and growing prevalence of chronic and complex health conditions, and these are more often than not managed in primary care settings. GPs and practice nurses often develop long and trusting relationships with patients, making general practice settings the ideal place to start and continue these conversations. Planning for the future is best discussed at a time when a person's health is stable. But yes, we acknowledge that there are challenges. If you are a health professional in the audience, I would like you to just now reflect upon some of the statements that are going to pop up on the screen that have been identified in the research as challenges in primary healthcare. How much do these resonate with your concerns around having these conversations? So perhaps patients are not willing or able to have face discussions about death and dying. And well, you do know your patients best, and it's okay if the conversation comes up and it's declined. Just acknowledge that the conversation and the topic can be revisited in the future. So Dore in her research found that many patients wanted to talk to their clinicians about advanced care planning. In fact, they expect healthcare providers to initiate the conversations, and they really view it as a way to prepare their loved ones and decrease the burden on decisional burden. And in regards to the fact that you may not want to deprive hope or damage the therapeutic relationship, really approaching advanced care planning conversations from the perspectives of values and preferences is a sensitive way to plan for the future. Conversations may start with, if you did become more unwell, what would be most important to you? Done well, advanced care planning conversations can support the therapeutic relationship and build trust. And these are challenging conversations. How do you feel about this? I feel trepidation, emotional, and I'm uncomfortable having these conversations. And we acknowledge that these can be challenging conversations. And to feel more prepared to have these sensitive conversations, it may be helpful to understand, is this the right time for you? Are you in the emotional state that is going to be appropriate for this conversation? Be realistic. Remind yourself of the benefits of advanced care planning. Good communication is fundamental as part of advanced care planning, and bringing empathy, genuineness, respect, and a non-judgmental approach. And really continuing that self-awareness and reflection is key to these conversations. And the big one, busy workloads, time constraints, inadequate training, and lack of remuneration are just making it all too hard. So let's touch on some of the key enablers, because we do know that there are some enablers in research that do assist with advanced care planning in general practice. The workplace culture has been recognised as significantly important. To successfully incorporate advanced care planning in general practice, the research tells us commitment from the whole practice team is an enabler. There shouldn't be a reliance on one staff member to initiate these conversations. The entire team, including doctors, nurses, practice managers, and administration staff, all require a shared understanding of the importance and value of advanced care planning, their roles, documentation, and funding strategies. And so the big elephant in the room, there is no specific MBS item for advanced care planning. But we can consider that advanced care planning conversations, documentation of expressed values and preferences in patient notes and in an advanced care directive, and uploading these to My Health Record may be completed over a period of time with short consults, or they may require a longer consult such as level C or D. From November 1, 2023, GPs and other medical practitioners can support people with advanced care planning under the new MBS item Level E consultation. The new Level E consultation item of 60 minutes or more allows GPs longer consultation times where clinically required. And this may be including people with needing extra supported communication, such as with dementia, various disabilities, or perhaps where an interpreter is required. Supporting processes to promote these initiatives may also involve initiating screening to identify suitable patients. Use of such things as the surprise question or the SPICT tool may be assisting. And opportunistic initiating of conversations can occur through recognitions of cues that your patients are saying things, and normalising the conversation through including it in standard consultations and age-specific health assessments, and perhaps chronic disease management plan reviews. Use of structured conversation guides and prompts can be assisting, and the Advanced Project team has developed a conversation guide for use with healthy people to open up the conversation. And the references below listed on the slide, you can actually find those. So I recommend having a look at those. But we do know that initiating the conversation isn't always easy, including for health and aged care professionals. So one of the ways that Advanced Care Planning Australia has put in place these conversation starter cards. And this may be something that the patients may take time to reflect on with their family, and then perhaps come back to you at a later appointment. It really is what works for the person. I also just wanted to highlight the prompts for end-of-life planning framework, or the PELP framework, that really provides guidance and on proactive quality end-of-life care across all care settings. So this can be used in primary health care and allows signposting and triggers for advanced care planning activities over the last 12 months of life. So the link is there for that resource. You're also able to access health pathways through your primary health network, and there are 2 gateways into that, and these really provide supporting practices through this supports your practice through local information resources and referral pathways. So there's some information there about the new login system that's been implemented recently. And in particular, there's a couple screen grabs of the advanced care planning pages that are available, and the information that can support your practice. And I did just briefly want to touch on the education that Advanced Care Planning Australia is offering. This is all free and available online to really support the health and aged care workforce. And we've taken the approach to use a micro-learning approach because we know that people are time poor, and it's a quiz-based web application. So it's intended to be fast, 20 to 30 minutes of learning. We've released the first campaign last month, which is What is Advanced Care Planning? And next week there will be Starting the Conversation, and we'll be releasing further campaigns over the next few months. So recommend you have a look at those, and happy for feedback. And really, just in summary, I just wanted to hit these key points and reinforce that advanced care planning is voluntary. It is an ongoing process, not just a once done and then that's it. It can be revisited in the future with the person. And it's completed by the actual individual in a shared process. And this process may or may not involve legally binding documents. And this is really for a time when the person is unable to communicate or make their decisions in the future. I've also just popped in there some useful resources that you may want to further consider. On our Advanced Care Planning Australia website, we have a Creating Your Plan in New South Wales page that has all of the information and links required. There's also a link there for the Digital Health website, which supports uploading of the documents to My Health Record. The links for the Hunter New England Health Pathways and Central Coast PHN websites with the advanced care planning links. And also there's another number of other reputable websites and resources out there to provide education and discussion prompts, such as the Palliative Care Discussion Starters. The Advanced Project has practical resources and training, and End of Life Law in Australia really does provide the most up-to-date and accurate information around the legal aspects around advanced care planning in Australia. So please do keep in touch with us via our social media accounts and sign up for any monthly e-news and our website for further information. And I thank you for your attention today. And I'm happy to take any questions, but I'm conscious of time.
Perfect. We'll open it up for any questions. If you want to turn on your microphone and your camera, please feel free. I may have missed this. Will the slides, resources, and links be made available? Yes, they will. Apologies again for the massive technical issues, but we have recorded this session. It will be available for you to view in our library. I will personally email it to everyone as well once it is up so that you have these resources, the PDF of the PowerPoint that was presented today as well. Any other questions? Got one coming through, so we'll just wait for that one. Thanks, Kylie. That was wonderful as well. Thank you so much. Just a thank you. Thank you, everyone, for being accommodating and jumping on here. And I do apologize if you got it a little bit late, but we have the full recording coming to you shortly. And we'll just wait and see a couple more typing. It's always the fun waiting. Are structured conversation guides available for us to use?
Yes, certainly. I can share the publication that the Advance project is available open access online, and it's got a great table which really has those, it's about 10 key conversation sort of starters and prompts in there. So that is available in that publication, but I can certainly lift that as well if you'd like me to send that to you personally. Yeah.
Brilliant. Well, thank you for everything today, Kylie. I will stop the recording here and say thank you again.
Thank you.